Well, to the coronavirus pandemic, 612 new cases around Mississippi gets the state closer to the 70,000 total cases, and the state is now under over 2,000 deaths after 22 new deaths were reported. But while numbers may not be getting close to 2,000 daily cases, another trend health officials are worried about are pediatric cases. Here in Mississippi, under 22,000 of the state's cases are pediatric, or nearly 31% of the state's total cases. Why is that number important? Because according to a new report from the American Academy of Pediatrics, Mississippi is 5th in the country in pediatric cases per 100,000 kids. And health officials fear that that number can grow higher as more and more schools reopen.
And 12 News' Anna Farish joins us live. And Anna, I understand you spoke with people today about this new study, which is frightening.
Yeah, Mel, I spoke with Dr. Alan Jones at UMMC, who says he's not surprised that we're seeing cases pop up in children, and it's just presenting itself differently than adults.
Sometimes children have milder symptoms that might not otherwise be recognizable in an adult. It's not necessarily that the symptoms are different as much as it just might be a little more difficult to detect those symptoms early on in the process.
Dr. Alan Jones has been fighting on the front lines against coronavirus here in Mississippi for months and has seen firsthand the impacts it can make. But with schools starting back and being a father, he can't help but be concerned.
I have some mixed feelings about it. I do think that it's going to result, in some increased viral activity, but I also think that at some point we can't close our society. We have to learn to coexist with the virus in a meaningful way that keeps us as safe as possible.
Dr. Jones says the study mostly applies to children 18 and younger, but it doesn't account for students inside a classroom.
Even with masking and social distancing, when you have groups, large groups, even small groups, indoors, in an enclosed setting, enclosed ventilation, that are interacting, you're going to have more activity than if you didn't have them.
He says there are a lot of factors as to why this is true, but mainly as rules around the state have relaxed, so did people's way of thinking. He says it's not that children are more susceptible, but the virus is now more widespread. He does go on to say that if the vaccine is created in the future, it could be something that schools require before children go back. I'm Anna Farish. Guys, back to you.